makakasama natin si Professor Magne Tvinnereim. Yan. At saka si Sir Vicente.
Dr. Vicente.
Dr. Vicente. Para pag-usapan natin itong sleep apnea. So, sleep disorder. So, can you tell us more about sleep disorder?
Yeah.
Ano po ba ito?
A sleep disorder is basically snoring, loud snoring, and with apneic spells. Pag sinabing apneic spells, we usually have disorder in sleep. We stop breathing for a while, about 10 seconds or more. So if we have this kind of problem, and then this is accompanied by sleepiness in the morning, okay? So, and then this basically constitute this kind of situation, problem like
Are
this.
they, sir, snoring is just part or symptoms of sleeping disorder?
Yeah,
Or
yeah.
not
But
necessary?
basically, it has been now considered as a disease
On its own.
on its own. On its own.
The
Are there-
question,
Go.
what usually causes snoring? Kasi some people say it's over-fatigue daw, o kaya sometimes wrong position, sleeping position.
Yeah.
But what really is the cause of
But
snoring?
basically, there is an obstruction in the upper airway. Okay, so it would start from the nose and start going down to the throat and also to the area where we usually would breathe. So there would be some obstruction. The palate would be longer than normal, and then the tongue might be very, very big, and then so that it causes obstruction, and then this
and we call it sleep breathing disorder, because when you fall asleep, you relax. And when you relax, your muscles are pulled together, and it is like putting a cork into your throat. So you like that when you are relaxed.
So, it's really dangerous.
Yeah, and
to
then
have
you
one.
do not get enough air into your lungs. And what happens when you do not get enough air into your lungs? You cannot get enough air into your blood. So your blood pressure starts rising because your heart starts work, and your brain does not get enough, or you may have a rise in the pressure, so you can have stroke, for example, and you can have cardiac disease, and you have diabetes because your hormones are not properly produced when you cannot get deep sleep. And even the men, a lot of these men do not get enough sexual hormones, androgens, so they get impotent, which is important for the daily life, as you know.
So my question now is, sir, is not all people snore on a daily basis. Some of them snore when they lack sleep, when they're overworked or stressed. Is it safe to say that all those who snore have sleep disorders, or not necessarily?
Absolutely not. But what is important is that snore is a kind of a symptom telling you that there might be something you should have a look at. Because some of the snorers snore because they are so closed that they get more work, and if you work more during the night, then you are in a risk zone.
So how do you know when it's time to, for example, you're sleeping beside somebody, and then he has different snores on different nights. How do you know when it's time to take him to the doctor?
Well, the first thing that happens is that you get tired in the morning, because if you have heavy snoring, you will not get the right amount of deep sleep, and then you get tired. And in Europe now, these days, from 1st of September, there is a new bylaw coming up for drivers. And if you are a professional driver, lorry driver, pilot, or something like that, and are tired, you have to go through a night recording. And if you have this kind of problem with breathing stops, then you will have to repeat it every year to document that you are not sick by tiredness. And this will come to your country as well quite soon, because there is an high increase of car accidents in this group.
So right now, you brought a tool that will help someone with sleeping disorder. Am I right? Where's the...
Actually,
Or
this
is
is
it
the
a
tool.
diagnostic tool?
Yeah, the thing is that up
Can
to
you walk
now
us
we
through
have
that
used
tool?
we have used the polysomnography, which is a lot of electrodes. You have to do it in the
Laboratory.
sleep laboratory, and we have for quite 10 years or so worked on a method which you also can bring home. So you put this small thread or catheter, it's less than 1 millimeter diameter, down into your nose, and you swallow it with a glass of water. No, it's not ooh. More than 99% sleep with it without any problems, and investigations have shown that it does not impact on your sleep. So it's not no.
No, it's not.
It isn't.
Like
So like this
And
one.
this, yes, it's like that one. And this, oh, isn't she? Yes.
she's smiling.
She is smiling. Yes, she loves this. And this gives us millions of observations about your snoring, about where the location is, because if we know where the problems are, then we can perform much better treatment. And then it tells us about breathing stops, about oxygen uptake, about which side you are lying on when you are on the most sick, and so on and so on. And it tells us if you are asleep or not, because if you're not asleep, then it doesn't matter. You have to be asleep to have these apneas or breathing stops. So this is a device which is very cost affordable, because it only takes 50 seconds to interpret the results automatically, while PSG takes 1 to 2 hours by a doctor. So this is, from today and tomorrow, something we can use on all the patients around the world in an easy and very, very reliable way. It's actually the most reliable way of diagnosing this disease.
And when you get the results, from who interprets this?
This is automatically interpreted, but you get the results when you come and talk to your doctor. What we do back in Europe, actually, and in India and in China, is that we put it on the patient in the evening. He or she goes home, comes back the next morning. My nurse or secretary takes it out, and we look at it for 50 seconds, and then we sit down with the patient and say, you are sick or you are not sick, and we should do this and this and this to treat you, and we can start treatment the same day.
But is this applicable to pediatric patients also?
To pediatric patients, yes. But, of course, it is not so easy to use this on children below 10 years. So there we have some strain gauge to measure the breathing. Yes.
But do we have any, or are there any preparations that we need to do before we undergo the test?
No. No.
Just basically just plug it in
not.
your
You
nose.
can have the. We prefer that you do not go home and gulp down a big beef. We prefer to have soup or something when you got this in.
The
But
wine too.
Sir, last question. Is this already available in the market, and how much?
actually, we are here now, and we have several companies interested in distributing it. So it will be in the Philippine market in
Very
some
soon.
few days, very soon. And the cost will be, I think, about $4,000, and that's 1/5 or 1/4 of what the PSG is costing.
Okay.
For those who want
The
to know more about the sleeping tool that you have discussed with us, where can they contact you for details?
They should go to their doctor. That's what we recommend, because the doctor will refer to the ENT, or they can go straight to the ENT or to the ENT departments. I don't know if you can say how that is.
Yeah, basically we have done some research with this kind of tool in Jose Reyes Memorial Medical Center. So we have we have started something like this in the past, and we will be having this kind of tool also in my department, in ENT in Jose Reyes Memorial Medical Center. Okay, you can call us in my number 0905 227 1525. So that's we can be contacted.
But of course, the best thing to do would be to come to me in Norway, because then we can go skiing. Yes,
For free.
for free.
Doc, ito, last question sa inyo. Gusto ko lang itanong, bakit yung snoring mas frequent kapag yung higa mo sa kama, diretso ka, hindi dun pagka sideways?
Because naiipit yung natin, airway
Yeah,
natin.
airway.
Pagka nakadiretso ka, no? So the tongue collapses, the palate also collapses, becomes longer, and then it obstructs the passage of the airway. Eventually, your lungs is also compressed and also gets obstructed. So you generally have that kind of problem. So when you do some positioning, it can be relieved.
Relief. Ayun.
And this invention measures all these things, and it's the only device in the world who can tell all the different types of treatment you can choose from in the right way, in the diagnostic way.
Because we can
It's the
readily
only-
identify the site of obstruction.
It's the only tool.
Unlike in other PSGs, polysomnography, the usual which we have, so it cannot identify the sites. This one can identify
So,
the
ang laking
sites.
tulong talaga sa inyo, Doc, especially
As
sa
an
mga
ENT
ENT.
specialist, it will be a big help.
Ayun.
Okay.
Thank you, and Professor Magne Tvinnereim.
Wonderful to be
Thank
with
you.
you. Thank you.
We'll be looking forward to your device
And
here.
ngayon, puntahan naman natin yung isang sure na hindi nagsusnore. Walang sleep apnea. Ayan si Ate Lynn Perez na nasa Barangay 162 sa Santa Quiteria, Caloocan City. Ate Lynn, magandang umaga!